So this research project was set up by the Wellcome Trust, who compiled a list of 26 active ingredients that they thought may help young people aged 14 to 24 with depression and anxiety. They wanted to know basically what young people and mental health professionals from around the world thought about those ingredients. We can think about active ingredients as cooking a dish. So when cooking something, for example, we need to use the right ingredients for the dish. But different people may use different ingredients because of what they like or dislike, or because of what is available to them, or because of their culture. This is true for depression and anxiety as well. There are a lot of ingredients that could help, and some people may like or use some ingredients more than others. Our project focused on better understanding what active ingredients young people want to use in different countries around the world, and whether we can find more active ingredients than the ones initially proposed by the Wellcome Trust. We worked with organizations from all around the world, and these organizations work directly with local young people with experience of depression and anxiety, and mental health professionals to explore these active ingredients. What we did is group discussions and interviews during which we talked about what the active ingredients meant to young people and professionals, what they thought might or might not work, and which active ingredients might be missing and which ones were more important to them. Two things that were very important for us in this project. The first one was we wanted to explore any new active ingredients that were not already included in the list and that were seen as useful for young people. But we also wanted to identify any cultural differences regarding those active ingredients that young people preferred. It was very important for us to involve young people in the research itself to make sure that activities and outputs were in line with young people's understanding and the feedback they gave us. And to do this, we worked with peer researchers and peer advisors from around the world who guided us and helped us keep young people in mind throughout the project. Peer advisors after the project told us that taking part in such a research project felt really empowering and allowed them to have a voice on issues that were important to them, and that they were able to use their lived experiences of anxiety and depression to make things a little bit better for others.
I never experienced working with youngsters, working with youth in this way, that they are of my age and they are sharing the problems which I experienced. So it was very easy and very comfortable to relate to each and everything they were saying.
So I really enjoyed the co-facilitation of the meetings in the UK and hearing back from the cross-continental study. We're all in different stages due to cultural and societal differences. So it was very informative to hear about the approaches we can take going forward to support young people.
We found that both young people and professionals had a good understanding regarding what we meant by the term active ingredients. Young people spoke a lot about the wording of the ingredients and said that they really needed to be written in a way that they could easily understood them. Some active ingredients were also hard to translate, for example, when we were talking about perfectionism or self-compassion, because those words do not exist in some languages. So based on their feedback, we made many updates to the initial list of 26 active ingredients.
In the UK, young people discussed the importance of having language that would be universally understood. So even if it was read by a young person or a health professional, the terminology and explanations could still be universally understood.
There was not one or two ingredient that was related to our culture, so that was the difficult task for participants to understand. Whereas we explained that in what context they are talking about in this particular active ingredient. So that was a little bit a difficult thing, but not the language, not the English or Urdu thing, but yes, you can say the context of the status or the active ingredient.
We also received feedback that words, for example, like better, positive, negative, improved or reduced may not be suitable. Young people especially ask questions like, who decides whether an activity is positive or negative for me? Or who decides whether a young person needs to develop better thought processes? This highlights the fact that individual circumstances are really important when choosing active ingredients.
When I attended the session with all the age groups, there was a gap. There was a gap between youngsters and professionals. I think youngsters are there who wants to share their experiences, who want someone who can listen to them, who can give them solutions, or who can just listen to them because they have solutions for so many things, but there is no one who is there to listen to them.
Throughout the project, many new ingredients were also added by young people and professionals, and the new list now has 65 active ingredients. Some of the new ones are feeling understood and accepted by family and friends, taking time to learn and understand yourself, awareness and education about depression and anxiety, and one ingredient around practicing religious or spiritual beliefs.
In terms of the cross-continental focus groups, the differences were the needs. I was really surprised by that because in other countries, the needs included learning and normalizing mental health, whilst for the UK, it surrounded subjectivity and the focus of the individual.
In general, young people and professionals found the following ingredients the most helpful. Something around learning problem-solving skills, the ability to shift perspective, developing new thinking patterns or understanding thinking patterns better, regulating or managing emotions, and having meaningful social connections. And what we found is that even though we talked to young people and professionals living in many different countries, actually there were only a few cultural differences that we can see between the most helpful active ingredients. And instead, every young person we talked to had their own preferences. So when using the list of active ingredients, it will be really important to tailor it to each young person and to allow them to choose what works best for them. The original 26 ingredients were separated depending on whether they helped with depression, anxiety, or both. Young people and professionals said that these separations were not needed because most active ingredients were helpful across all areas. Based on what they said, we reorganized all ingredients into 11 themes, grouping together ingredients that were related or similar. For example, the theme Understanding and Accepting Yourself includes active ingredients such as improved view of self and self-confidence, being kind and respectful to yourself, and taking time to learn and understand yourself.
When I was being part of this project, I was saying that how things are going to happen, how the activities are going to be happen. But everything was very structured and implemented very well by all the team members, by all the organizations in other countries. And similarly, like I used to get so many questions in my mind that how things are going to happen, but I used to get all my answers before asking the question. Similarly, when I was thinking about the active ingredients, I thought that these were 26 and we have made so many more active ingredients in the list. So how are we going to present it to the youth? But when I saw the theme part, I was very much excited and happy that how beautifully, how presentable they have made these active ingredients by putting them under one theme so that people can understand easily.
To make it a bit easier to visualize, we organized the themes around the young person. So basically, certain themes are closer to the young person, such as understanding and accepting yourself, or looking after your body. And all these things young people can do or control to better manage their depression and anxiety. Other things are broader or further away from the young person. Young people may have less influence over them, but they still impact on depression and anxiety. For example, things in the society and environment theme. We hope that the list of active ingredients will help young people to build their own recipes to tackle depression and anxiety. But having a recipe and being able to cook the dish are two very different things. So next, we want to give young people, families and communities the tools they need to use those active ingredients. Based on the findings from the project, we suggest using one list of themes and ingredients globally, with the option for young people to make the list fit for them. Individual young people, rather than their family or mental health professionals, should be able to decide what active ingredients they use, with guidance from adults where appropriate. And young people can be valuable mentors in their school and communities, so they could help their peers or younger children to access and benefit from the active ingredients findings. And finally, we should think about the best ways to train professionals to use the list of ingredients and how young people can play a role in the training. We would like to say a massive, massive thank you to all the peer advisors and peer researchers that were involved in this project, as well as all the partners around the world who made sure that this project could be delivered successfully. And of course, thank you to all the young people and professionals who joined the discussions and shared their thoughts on those very important topics.